Okay, we may have, sorry everybody, just making sure that you all can hear us now. This is Gillum Ferguson with the Governor's Office. We're going to begin here. The Governor will give opening comments followed by Dr. Lisa Piercey with the Department of Health. For the Q&A portion, if you can use the raise hand feature if you would like to ask a question of the Governor on your WebEx application. With that, we'll turn it over to Governor Bill Lee.
Hey, good morning. Thank you all for joining us today on the first of our outreach to you in 2021. Happy New Year to each one of you. Starting a new chapter in our state. But we will continue today to report on things that are developing, particularly on the COVID front. But before we get into health updates today and otherwise, I want to just make a few comments regarding my responsibility as the governor and our work that has begun with the new Biden administration and the work that we have to advocate for Tennesseans. Yesterday, I was scheduled to speak with President-elect Biden along with other governors. While President-elect ended up not being able to join the call, I did get to share with members of his transition team about our COVID-19 response, and as the Biden administration prepares to take the helm, we've begun to work together. We've started this process of advocating. That's the business of the state. I look forward to working together in the coming days to make sure that we get the best outcomes for Tennesseans that are consistent with our policies that we think are best for the people of our state. I will say the turmoil that we saw this week says something about where we are as a country and the chasm that occurs when we rely too much on politics to fill a void. Our national identity has never been politics. It's been our principles. And I believe that this new year offers us an opportunity to recommit to those principles. I will make every effort to do that. The principles of unity and compassion and thoughtful leadership. Disagreements occur on policy, on politics, but my goal will be to be thoughtful and principled and wise in the days ahead as we work with this new administration, because that's what our country needs the most. There are a few items I want to briefly touch on before we get the health update from Dr. Piercey, but I just wanted to share those thoughts to start off as we begin our work with the Biden administration. Regarding vaccine rollout, the successful rollout of vaccine distribution has been our primary focus for the last few weeks as we build on the foundation of a testing infrastructure and a partnership with our healthcare providers. We are now deep into vaccine distribution. We have made the choice to continue our phased vaccine approach, but to open up our vaccines to Tennesseans 75 and over due to their risk, in particular of hospitalizations and deaths. 75 and older citizens contribute to more than 50% of our hospitalizations and deaths, and making vaccines available to them is going to be very important in curbing the caseload in our state. The biggest barrier, of course, as we all know, is our limited supply of vaccines as companies are working overtime to make doses and getting them out the door, and we are working overtime to, when they come into our door, getting them into the arms of our citizens. And our folks are working and partnering across the state to make sure that gets done. We also are focused on making sure that we don't waste any vaccine along the process, and to date, we've been very encouraged by that, by the outcomes there. Also, I'm encouraged by the number of Tennesseans who want to get vaccine. We want to encourage folks that are working to make this widely available as soon as we can. And Dr. Piercey will talk a little bit more about that shortly when she gives her report. On the unemployment side, on the unemployment front, we are continuing to see our numbers trending in the right direction. More Tennesseans are returning to work. We saw an uptick in claim numbers this week, and we're looking into the reasons for that, but our overall unemployment rate continues to drop, and we're very encouraged by where that's headed COVID-19 has created a tremendous hardship for many, and Tennessee is one of the first states to begin administering the latest CARES Act extension to make sure that those dollars go to the Tennesseans that need them most. We're seeing really positive trends in reemployment. Now, I'll note that we have the highest apprenticeship rate that we have had in over a decade right now in Tennessee, and that's very good for the folks that are equipping themselves with the skills necessary to be successful as our economy continues to return. And I want to commend the employees who are investing in these apprenticeship programs. This kind of programming that helps Tennesseans skill up and have long-term abilities to provide for their families. We'll continue to provide career fairs virtually, make sure that Tennesseans that are looking for work know about the 250,000 available jobs in our state. We have a great opportunity to provide opportunity for Tennesseans like never before. I appointed this week, I'll talk a bit about a new commissioner. I appointed this week Clarence Carter to lead the Department of Human Services. Clarence joins our team after serving 3 Republican governors, 2 presidential administrations. What I'm most excited about is Mr. Carter brings significant expertise regarding programs and services that Department of Human Services administers, particularly TANF, as he was instrumental in the TANF program on the federal level. So he'll be a great asset for our administration. To build on the work of the TANF working group and to allow us to better serve the Tennesseans that we do through our Department of Human Services. We'll be welcoming him later this month, and we look forward to his leadership. As you know, we've met a special session call. We're getting ready to start one of the busiest seasons of the year with the legislative session. We'll announce the official call next week of our special session and more about the specific policies that we'll be putting forward to address the very serious situation facing our kids as a result of COVID-19 and learning loss that came with that. The special session is slated to begin on the 19th. So there is a lot happening, but I'm going to ask Dr. Piercey now, before we take questions, to share a bit, to give a brief health update. Dr. Piercey.
Thank you, sir. Good morning, everyone. Just a few brief comments, particularly about vaccination efforts. As you will see in the dashboard when it's published later today, we have now vaccinated over 215,000 Tennesseans, which is approximately 3% of our population. On that dashboard, you'll see that broken down by county, and some counties are approaching or even have exceeded the 7% mark. So we're really proud of that, proud of our efforts, but we are always looking for ways to improve, and I've got a few comments about that in just a minute. I think you've probably seen some of the national news that we're doing fairly well compared to our other states as far as both number of total doses administered as well as percent of available supply administered. As the governor mentioned, I will reiterate because it's the most important thing and the most frustrating thing to everyone, which is limited supply. And so our goal, we can't control the supply. And so we order every single dose that is made available to us as soon as it is made available. And then our goal is to get it in an arm as soon as it gets into the state. And so we've had some good luck with that so far, and we're always adjusting to try to even improve upon that. So I also want to draw your attention to our long-term care partnership. As you know, over 90% of long-term care facilities in the state are partnered through the federal partnership with CVS and Walgreens, with the remainder through local independent pharmacies. We have currently allocated about 96,000 doses to that partnership, and that allocation will continue through the end of the month. So when we get an allocation in the state, we do have to take some off the top and give it to that partnership to ensure that all of our long-term care facilities are going to have vaccine. So far, about half of the skilled nursing facilities, which is the highest level of acuity, basically the sickest people in the long-term care spectrum, about half of those facilities have already been completed by CVS and Walgreens. On our vaccine dashboard update later this afternoon, you will notice some new information about CVS and Walgreens. I will caution you that there is a lag in that data, although both of those entities, large retail entities, are working towards a more real-time, transparent data system. And so as we get that information from them, we will update it. But I do want to note, and there will be a footnote on that data, that there is some lag and that the actual number likely is a little bit higher. So when I mentioned skilled nursing facilities being the most acute or the sickest patients, that's the same approach that we've taken all the way through all of our prioritization. Start at the highest risk first and then work your way down. Same thing in our long-term care. While long-term care residents are at higher risk than those in the community at large, those in assisted living are more independent and less medically fragile than those in skilled nursing facilities and nursing homes. So those take a lower priority in the whole long-term care, not because they're not at risk, but because we're taking the risk-based approach. Those assisted living facilities are scheduled to begin vaccination at the middle of next week, could be sooner in some instances. Those are also through CVS and Walgreens and will be reflected on our dashboard. Our dashboard will also, in the version produced today, will be in a more interactive format than a static PDF. So I hope your readers and viewers enjoy being able to interact with that. Finally, as you may have heard, we are getting ready to stand up a statewide online scheduling system. This is another bit of evidence of how we are constantly iterating and improving and being flexible and adjusting on the fly to what we learn, because we've never undertaken something this massive. So there are going to be lessons learned along the way. And so this is an effort to minimize the number of people who wait in line for hours and hours and then sometimes could be turned away due to exhausted inventory. So we realize that it's a little bit more of a hurdle on the front end to do the online scheduling, but I think not only for staff in health departments, but certainly the public at large, that will be a much more satisfying system than sitting around for several hours and may or may not get a dose. So you'll see that launch next week, and we're looking forward to streamlining that process. I'm happy to take questions later if you have any.
Dr. Piercey, I want to make a comment about monoclonal antibodies, and if you would like to add to it, please do. But while we're on this call, we certainly could use media's help in getting this message out to Tennesseans. We have available in this state for this therapeutic to be effective, and so many folks don't contact their healthcare provider in order to ask about monoclonal antibodies. We have them available. They're very effective, particularly in this period of time before we get our elderly population vaccinated. If you are 65 or older and you test positive for COVID and have begun to get sick, but you're not sick enough to get to the hospital, we urge you to contact your healthcare provider, your doctor, and ask them about monoclonal antibodies and that therapeutic that could be helpful. Dr. Pierce, do you have anything to add on that?
The only thing I would add, sir, is that these therapeutics are upwards of 85 to 90% effective at preventing progression to severe disease. So that means almost all people who take them in time have a very, very reduced chance of being in the hospital. Not only does this help individual patient outcomes, this helps hospital demand as well. So this is a therapeutic that we have available in the state. We have not used our entire inventory, nowhere close to that. And so we really are trying to get the word out to seek treatment early once you test positive.
Okay, thanks, Dr. Piercey. All right, I just wanted to, I had forgotten to say that. I wanted to get it out there before we got to questions, but I'm happy to take questions and note Dr. Piercey as well.
Thanks, Governor. First, we'll go to Jonathan Mattise with the AP. Jonathan, go ahead, please.
Hey, Governor. There are reports that FBI agents are currently or have been today at Cordell Hull searching legislative offices and some home addresses of lawmakers. What do you know about that at this point, and have agents been up to any of the executive branch or governor's office offices at this point?
So I've spoken with Speaker Sexton this morning, and I'm aware of the FBI raids. It's certainly very concerning. I know very little about that. There's been no FBI outreach to us, but I have confidence that Speaker Sexton's on top of the situation, and we'll learn more as this unfolds.
Okay. And to follow up on a different topic, curious to see what are your thoughts on the president's role in the riots that occurred recently at the Capitol?
Yeah, I have been focused and will continue to focus. And what I believe this country needs is for leaders to be focused on how it is that we move forward. What happened in the Capitol was tragic. I completely condemn the violence that occurred there. It's a sad day for America. It's also a day for us to begin the process of working forward. That is certainly my desire. That's why we will work to advocate for what's best for Tennesseans with the new Biden administration. Politics, as we've seen over the last several weeks, has failed us, but principled leadership is fail-safe, and that's what we want to do going forward.
Thank you.
Next, we'll go to Kelly Roberts. Kelly, go ahead, please.
Hey there, good morning. I'm Dr. Piercey. I'm here in Shelby County, and I know that health officials here have, expressed that they are on their last doses of their first allotment, at least to the local health department here, and that they're working with the state to just learn more about when a next allotment and how many could be coming in that allotment. And what can you say about maybe a second allotment coming to those counties who may be needing them right now, or also any plan to reallocate, some that just haven't been used in other counties?
Hey, thanks for those questions. I'll address the latter one first. There's really not any unused vaccines sitting around. And I have told all health departments from the very beginning that their goal is to run out as quickly as possible. I realize that that's difficult to swallow, but that also means because that means there are some days that they don't have vaccine. But I want them deployed as fast as we get them. So there's really not any to be redistributed. On the earlier question about allocation, now that we've gotten through the initial ramp up over those first couple of weeks, the month of January is producing a bit more of a regular cadence. So that cadence, when it goes as planned, and so far it has, is that the vaccines ship on Monday, they usually arrive on Tuesdays, and then the portal opens up on Thursday nights for us to order the next week's allotment. So last night we would have gone in there and maxed out all of the available ordering that we could. And then at some point over the weekend, I believe that's generally on Saturday or Sunday, we will be told, okay, you can have that amount, or it's going to be reduced or increased a little bit. So we usually get a pretty short turnaround time frame on that. Maybe about 48 hours before it arrives at the site, but it should be a regular cadence with Shelby County as well as all other sites getting resupplied on Tuesdays.
Okay, and I guess just my follow-up, just based on your answer. So should counties expect more vaccine this Tuesday and then also next Tuesday? And how much, say, yet last night, how many doses did you guys request, that at least you hope to get?
Yes, so the allocations through the month of January should be pretty steady. We initially thought they would be around 90,000 a week. It's turning out to be closer to 80,000 or maybe just a little bit above that. We don't anticipate any wide fluctuations for the rest of the month. General Perna did mention yesterday with Operation Warp Speed that there could be a possibility to increase the weekly allocation towards the end of the month and then into February. So we're hopeful for that, but they should get a regular cadence of pretty much the same allocation every Tuesday for the rest of January.
Thank you.
Next, we'll go to Yue Stella Yu with the Tennessean. Go ahead, please.
Hi. So my question is to Governor Bill Lee. I was wondering what kind of, help you would hope to get from the new Biden administration for Tennesseans.
So yesterday we began speaking with their COVID-19 team. It was a call with several governors. We talked about supply of vaccines. We talked about flexibility around funding in the new federal funding that's coming to our state. We talked about therapeutics and the shipments of those therapeutics. We talked about how it is that we could provide for mass testing sites across Tennessee to allow for more Tennesseans to be vaccinated more efficiently as more vaccines come online. So we talked about regional approaches and how governors regionally can work together. The governors were on that call from North Carolina, Georgia, North Carolina, Mississippi, Alabama, New Orleans, Louisiana, that is, Arkansas. So there were a number of governors on the call and talked about regional approaches and what's most helpful for us. So that's been our first interaction with the administration and how it is that we can work together to accomplish what we need to on COVID-19.
Thank you.
Next, we'll go to Kyle Horan with News Channel 5. Kyle, go ahead, please.
Thank you. This is a question for the governor. Recently, we did a story about how teachers have struggled. Tennessee Education Association saying that 84% of them are experiencing more stress. 84% of them are working at least 13 hours a week on top of what they would normally work as teachers in a normal year. T's suggesting that one way just to help them do their jobs, reduce that stress, is to give them teacher pay raises. I know that's something in the past, Governor, that you said you would like to do. Is that still looking like something that may happen in 2021? Are you talking to any of the lawmakers about that, perhaps the speaker?
Yeah, so let me address your first part of that, and then the second. I want to just say, as I've said many times, teachers have had an incredible challenge, and I want to applaud the effort of so many teachers who recognize the importance of their calling, especially in the midst of what we're dealing with now, how critical it is for students to have access to learning, in-person learning, especially low-income students and special needs students. So teachers are doing incredible work. We have worked to provide resources. You talked particularly about some of the emotional challenges. We have, besides what we've done to try and provide for a safe work environment for them with PPE and disinfectants to all the classrooms, many of our teachers have taken advantage of COVID-19 emotional support hotline that's available, free classroom resources to support their instruction and more. So we want to continue to try to be a support to teachers wherever we can. And we certainly hope that we will be able to provide increases in pay for our teachers. Our special session will be coming out. We're working out the final details of what will be in that special session. Obviously, the legislature and the governor's office will work together to accomplish that, but it's our hope and our belief that we will advocate for and work together with the General Assembly to make a way to provide for additional funding for teacher pay raises.
Governor, the people that we were talking to, one of their big complaints was that there wasn't like a statewide plan in place that everyone should follow. They just didn't feel like they were getting enough guidance from the state on these issues, how to deal with the schools, how to deal with the spread of COVID, whether or not to be virtual or in person. Is going into the second semester, is there anything that you guys have to say about that?
I think what is most important that we believe is that local decision-making is incredibly important. Parents weighing in with their local school districts, weighing in with their superintendents and teachers about what their community's needs are and what the desires of those each individual districts are. That is the best way. A statewide one-size-fits-all approach to school districts is not the best approach from our perspective. We will continue to work and to provide support for school districts. We work really hard. Our commissioner has regular, weekly, bi-weekly, continuous conversation with districts, superintendents, leaders, teachers, principals, to make sure that we're providing the information that they need and the support that they need. But we strongly believe that local decision-making is important.
Thank you, Governor.
Next, we'll go to Julia Ewald with WBBJ. Julia, go ahead, please.
Hi, this question is for Dr. Piercey. Over the course of giving out this vaccine, what have you seen that works really well as to getting it out to the public? And what have you seen that you guys need to work on and maybe get help to do better?
I think Dr. Piercey's off the call, by the way. She had to drop off. So I'll attempt to answer that. I think from my perspective.
Okay, that's fine. Thank you.
Yeah, I think from my perspective, what's gone well is that we have shown that our pre-planning, the CDC actually, and Dr. Redfield, the CDC, acknowledged weeks ago that Tennessee's plan for distribution was the best in the country. We're seeing that play out now because we are also distributing available vaccine faster than most any state in the country. A couple things we've done well. We've been flexible. As things change on the ground, we've changed because we meet together daily about what adjustments we need to make. Our model has been primarily centered around risk of individuals, including elevated risk with those that have high social vulnerabilities. So really making sure that equitable distribution is a part of our plan. Those things have all gone well. What hasn't gone well is that we don't have enough vaccine. And that has created anxiety, it's created frustration, it's created long lines, it's created a misunderstanding about what vaccines are available and what we should be doing to make sure that everyone that wants one gets one. The fact that vaccine has been slow and limited to roll out has been a great challenge for us. I will say we can all step back and remember that the fact that we have vaccine at all in less than a year of the onset of this pandemic is remarkable, but the rollout of it nonetheless has created frustration, and that's been the one thing that we wish would go better, and we actually are pretty hopeful about where that is going forward.
Okay, thank you.
Governor, that's the time we have for questions if you'd like to close.
Thank you all for taking time. Thank you for the job that you do and the important role that you play. And let me just say that while there are a lot of things going on around us, I continue to be very hopeful about where we're headed as a country, where we're headed as a state, and we will work very hard to make sure that Tennesseans are advocated for at every level, and that we serve the people that we're responsible to serve in the best way possible. So thanks for being on the call. We'll do it again soon.